Now we go live at the count of 1, 2, and 3.
All right, good evening, everyone.
Good evening.
Yes. Welcome to this webinar. Our esteemed guests, we welcome you to the fifth Nurse Midwife led webinar 2021 series. The webinars are organized to offer a platform for nurses and healthcare workers to share experiences and learn from one another as part of strategy to support the well-being and resilience of the nursing and health workers workforce. During this time of COVID and post-COVID-19 pandemic, the webinars are organized by the nurse midwives who are in teaching, or so we talk about the nurse and midwife educators and professional associations. Specifically, there is the Kenya Progressive Nursing Association, represented by the chair, Mr. Michael Nyongesa. We have National Nurses Association, represented by the president, Mr. Obengo, and the team, Jessica and Moses Chirchir. From NNAK, again, we have the technical team, who are the technology specialists in this webinar. There's Jemima, Rashid, and Teddy. We have the 4 schools of nursing in Kenya. We start with Moi, represented by Dr. Dina Chelangat. JKUAT, represented by Dr. Albanus Mutisia. MKU, represented by Dr. Ruth Mbugwa. And the University of Nairobi, represented by Dr. Mageto, Dr. Jebet, Dr. Umondi, and myself, Miriam Wagoro. This 2021 webinar series are supported by the Bardet Trust for Nursing in the UK. And we intend that after all these webinars, we should be able to document nurses' experiences through a book. Our topic this evening is health workers' mental health concerns during COVID-19 pandemic, strategies for resilience. We all know and we have read that healthcare workers are going through a very challenging time. There are so many mental health issues, but it is important to look at the strategies that we can use for resilience so that we continue offering quality care. So to speak to us on this very important topic are our eminent speakers, whom we are proud to introduce to you. We start with Dr. Richard Owino Ogutu, who will be the first speaker. Dr. Richard Owino Ogutu has a very interesting background. He is a BSN with a master's in mental health and psychiatric nursing. He's also a medical doctor currently pursuing a master's in psychiatry. So Dr. Richard Owino is both a clinical mental health nurse specialist and the psychiatrist in making. That then tells you how passionate he is about mental health. Our second speaker is a very able nurse, Mr. Francis Gitahi Njenga. Mr. Francis Gitahi Jenga is a KRN-M. He also has Bachelor of Science in Community Health Development. He is the coordinator of many programs, including COVID-19 home-based isolation and care, and also the HIV/AIDS, where he is the key populations coordinator. To moderate this session, we have our able moderator, who is none other than the Registrar and the CEO of the Nursing Council of Kenya, Madam Edna Talam. So then I shall hand you over to Madam Edna Talam to be able to moderate the session. Thank you very much, our guests. Feel welcome and feel at home. Thank you. Over to you, Madam Talam.
Thank you so much, Dr. Miriam Wagoro. And good evening, colleagues. Good morning, good afternoon, wherever you are joining us. Welcome to our today's webinar on health workers' mental health concerns during this COVID-19 pandemic, and also strategies for our own resilience. As we have been introduced by Dr. Miriam Wagoro, we will have with us the panelists today who will be able to speak to us on their thoughts in regards of these issues of mental health. We are all aware that there is no health without mental health. And in this space where we are with this pandemic, I think the discussion and the reflections within our own self as healthcare workers will be able to support our own resilience on how well we can be able to do the coping, how we can be able to support ourselves as a profession, how we can support our co-workers, and at the same time extend to our families and the communities who really deserves our own services at this moment. We are going to start off by Mr. Rashid, who I will kindly request to take us through the poll for this session. Rashid, welcome. Okay, Rashid, could you want to take us through this poll? If you can unmute yourself. Mr. Rashid?
Thank you, Madam Registrar. So the poll is just to guide us to be able to understand the level of which or where you stand as a healthcare provider. Once you're done with submitting, once you're done with responding, just do press the submission button, then we shall be able to share the results within a minute for us to be able to understand the baseline. Thank you so much.
Thank you so much. And there we have been able to submit. Thank you so much, Rashid, for taking us through this session. I just want to quickly go through the ethics of our today's webinar. First, to start off, I will just want to kindly request that we all mute our mic, and when you'll be given a moment to talk, then you can only unmute. We also have our chats where we can be able to utilize for question and answer, for you to give us greetings, and for us to be able to exchange our communications. Please note that we are recording this session. We are live on Facebook, and we'll be able to share the presentations within the institution represented in this webinar for us to be able to read later and for us to be able to also go through them. I also want to note that within our reactions, we have where we have the Q&A. You can go there and click and post your questions. We also have a button for raising our hands. I will be able to see whoever was raised the hands, and during the time that we'll be able to have our discussions, we'll be able to quickly guide in who is supposed to be able to talk. And of course, finally, we also have our video. I'll request that if you are in a position to put your video on, especially when you'll be answering questions, that will be awesome. But just in case you are not able, that will also be fine too. So it is my pleasure now to go and invite our speaker, Dr. Richard Owino Ogutu, whom we have been able to, they have read for us his CV in regards of his career, both as a nurse with his interest in the mental health, and of course, having special interest on discussions of psychosis, on issues of anxiety, and also the psychiatric related illnesses, and also management, which will also be able to be beneficial to us. Dr. Richard Ogutu will also be sharing his PowerPoint presentation and take us through for the next 20 minutes. And so for us to be able to do that, I just also want also to note that we have the host sharing for us the poll results, and which we have been able to finish up. So overall on how we will all be able to rate our healthcare workers, 14% as reported to be excellent, and 27% somewhat good, average 44%, and somewhat poor 14%, and very and poor at 2%. So we are where we are at a majority of us as said average and below. And only a few proportions have been able to rate ourselves excellence. Have you ever felt a need of seeing a mental health therapist over the recent past? And 37 of today's attendees have also reported that yes, and 48% have also said no, and a few proportion have said they are not quite sure. So thank you so much, and we'll be able to run the final call. I just want to welcome Dr. Richard Owino Ogutu. Karibu sana daktari, and please take us off. Asante sana.
Thank you very much, Madam Registrar, for this opportunity. And I believe that everyone can hear me loud and clear. Since we had tested the mic before.
Yes, we can hear you very clear. Go ahead.
Thank you very much. So today's topic is a very important topic. We have had several series of this kind. And I'm very pleased that the COVID pandemic has given us a platform to do things a little bit differently, but effectively. So today we'll be looking at the strategies for resilience by the healthcare workers who may have concerns with their mental health. From the poll, we can already see that there are some that are still not sure, and that's not unusual when you're talking about mental health matters. So that's just a bit of my bios, already been told. So the COVID-19 pandemic has left healthcare systems around the globe faced with the challenging difficulties combating the pandemic as well as its sequelae. Health systems and their drivers, more so as the healthcare workers, are at higher risk of suffering various degrees of mental health related problems. During the International Health Regulations Emergency Committee that was held on 31st of July 2020, they concluded that the pandemic will require sustained long-term response efforts at the community, national, regional, and global levels. Tedros, as we know him, the WHO Director General, shared the same sentiments by stating that many countries that believed they were past the worst are now grappling with new outbreaks, and this Kenya not excluded. Some that were less affected in the earlier weeks are now seeing escalating numbers of cases and deaths rising. The same WHO has continued to mobilize global organizations and multilateral partners for COVID preparedness and response to support member states in maintaining health services while escalating research and eventual access to diagnostics, therapeutics, and hopefully effective vaccines. Since the announcement of the first COVID-19 case in Kenya, which happened in March 13th, the year 2020, the new cases and their impact have been on an upward trajectory. Currently, the impact and spread of infections are feared to be exhibited by really our socio-economic situations, which include large populations living in poverty, weak health systems, overcrowding in informal settlements and some rural households, and poor access to sanitation and general hygienic services. Those are just a few socioeconomic situations that has led to increased spread of the virus in our population. So to have a look at the mental health concerns, just nice to have a bit of intro to this, that the well-being and mental health of healthcare professionals continue to elicit discussions at different levels. This webinar not exclusive. Many healthcare workers are contracting infections. Some others who remain in contact with those positive cases are going to self-quarantine, which eventually creates pressure and burnouts in hospitals as well as tertiary care units. Different governments have requested their citizens to take actions, some of which include many sacrifices that may result in dignity violations and psychological distress that results from actions or even the lack of them. The Kenyan government has taken various measures to curb the spread of the virus, and this includes dusk to dawn curfew, closure of public spaces such as schools, public events, bars and restaurants, churches, and name them. They've also limited movements and ensuring hand hygiene and social distancing. Remember that all this, they have the advantage of controlling the virus, but they have serious negative effects to our mental health of the general population, of which the healthcare workers themselves come from. So they are not excluded. As much as the general population suffers the impact of these measures, they do suffer the same. Again, there is no doubt that the negative socioeconomic impacts such as job cuts, reduced business income, forced reduced working hours for staff has led to disruption likely to affect mental health of our healthcare workers, whom are part of the general population I've already mentioned. The specific healthcare workers' mental health concerns this presentation, my considered opinion includes isolation and loneliness, uncertainty, fear, anxiety, depression, suicidal thoughts, substance abuse, and even worsening the pre-existing mental conditions, among others. So it will be important to just have a look at each one of these before we quickly move to the resilience strategies. So what has led to the feeling of isolation and loneliness? These factors include social isolation, or rather social distancing and avoiding gatherings, stay-home orders, wearing of face masks, and forced quarantine, of which we remember initially when the virus started, that was the original strategy, which led to a lot of stigmatization, which again affected the mental health of many members of the populace. Effects of this are likely to be depression, suicidal ideation, heightened anxiety, overeating, substance abuse, and conflicts. Studies have shown that if you isolate partners together for long, then you're likely to escalate partner-related conflicts as well as domestic violence. Overeating follows if an individual is isolated, is feeling lonely. Some get strength from eating, and we know that when this happens, they're likely to gain more weight, and this tend to lead to low moods. Number two, uncertainty and fear. People are uncertain about the future in both health and in terms of economic, and this has led to widespread and exacerbation of symptoms for those with the diagnosed mental disorders. People also have financial, economic uncertainty. This includes the healthcare workers. Some healthcare workers have also experienced salary reductions or salary delays. So this uncertainty, of course, spirals leading to fear and chronically leads to anxiety disorders. Healthcare workers fear being infected, they fear economic downturn, they also fear unavailability of specific medicines. Even the current vaccines that I believe that most of us have received, we are not quite sure what to expect in the future. All this builds up to uncertainty and fear that surrounds this pandemic. Anxiety is our number 3 problem. This resulted from the 24/7 media coverage. It's traumatizing to see how many people get impacted by the pandemic through our television screens, through social media. Number 3, working remotely under pressure from some employers also worsens anxiety among healthcare providers, especially the team leaders. As we do know that even this webinar presentation is off hours, so lack of division between free time and work time has also led to serious anxiety levels. Team leaders find it necessary to have work extended beyond the usual expected hours of work. Like now, you can imagine the whole day we have been busy, but now we are expected to at least sit and have a discussion on this at the expense of our personal time. And this is worse when you're talking about the nurse educators, because we tend to have clinical work during the day and we prefer that we have our classes late in the evening, not knowing that we are not giving ourselves time to rest. And we'll see as we're looking at the resilience strategies, rest and sleep is one of the key issues that we need to insist on. COVID pandemic has also worsened existing anxiety states. We do know that healthcare workers are not exempt from mental illnesses. There are those that have PTSDs, there are those that have obsessive compulsive disorders. So these have been worsened by the COVID pandemic. And I see quite a number of anxiety disorders in the clinics, in the wards, issues that were never common before. We used to treat schizophrenia and mood disorders, but anxiety was considered an issue. Now it is becoming as one of the main mental disorders that people are seeking help for. Number 4, fourth mental health concern will be depression and suicidal ideation. And this, you may realize if you have these issues, you may be having depression, lost interest, as well as reduced energy levels, altered sleep and appetite, or rather eating pattern, reduced energy levels, negative view of the future, constantly having ruminations that there'll be no treatment after all. This could be a punishment from God, or the no vaccine, the vaccines, maybe they are meant to kill Africans. There are a lot of issues that people may harbor. Then the last one is the self-blame. People tend to have, or rather blaming themselves for the economic failure, which are not necessarily their fault, but because of COVID, they may have lost a relative very close to them. And as a health worker, you can easily blame yourself for not having done enough. And all this can lead to depressive symptoms as well as suicidal ideations. You may also have recurrent thoughts of taking one's life. A few cases, people, health workers may feel overwhelmed, and they will rationally argue that the only way to get out of the problem is to leave the world by taking away their life. Then the 5th mental health concern is substance abuse, and this could be as a result of maladaptive coping strategy to anxiety related to COVID issues. do know that substances tend to offer temporary reprieve from the socioeconomic downturn due to COVID and any other socioeconomic problems. Few working hours. This has made it really possible for some healthcare workers to have more time available to them for substance-seeking behavior, which is not productive or rather protective to matters of their mental health. How do you know that all is not okay? When you have a constant fatigue, this could be an early sign that things are not working well. Usually, we do expect that a good night's rest should make one feel refreshed and ready to take on the activities of the next day. However, going to bed tired and waking up still tired is not usual. So if you have such experiences, that could be a sign that all is not well with you as a healthcare worker. Number two is anhedonia and avolition. If you are unable to enjoy time with your family and friends, you can't find the energy to exercise or fall asleep when reading a good book or watching a nice movie, you could be experiencing physical exhaustion, which is an early sign of psychological distress. Feeling of overworked or underappreciated, this is not unusual, especially in the nursing profession. Us as nurses, many times we feel like our efforts go unnoticed and feel overworked. When you begin to feel this way as a healthcare worker, take the time to figure out what could be the problem. If you are taking on too many responsibilities, see if you can get some help. If your supervisor is not giving you enough support that you need, it is important that you let him or her know about the same. But of course, with respect, because you're still in your job. If you find yourself frustrated or resentful at work, it may be time to think about whether your job still fits in your lifestyle and your goals, or it just may be the right time to change. Then you have compassion fatigue. Most nurses, most healthcare workers, when you get into our professions, we do because we are very compassionate. As new employees, we tend to be very compassionate with our patients. We do all that they need. We do all that we expect people to do to us. But after years of emotional stress, coupled with pandemics like COVID, witnessing fear, pain, people suffering, even the best nurses in the world can suffer this fatigue. If you are detached from your patients, you feel a bit cynical about your job, or feel like you are failing as a nurse educator or a nurse clinician, you could be a victim of compassionate fatigue. This is a huge red flag for a nurse psychological distress, and therefore it should be addressed straight away. And then the last one is lack of enthusiasm about your work. Are you just going through the motions at work? It is important to ask yourself that. Another early sign of burnout is loss of enjoyment of your job. Remember that. When you're at home, you lack enthusiasm about or even dread going to work. Once you are there, please remember you can only think about, or rather, once you are at work, you can only remember going back home. When you have such feelings, please, you could be suffering lack of enthusiasm, which is a hallmark that things may not be okay. So these 5 signs are very important that we need to be on the lookout as healthcare workers. When you notice this, it could be a signal that things are not okay with us. So what are the resilience strategies? Please remember this quote, that when the going gets tough, the tough gets creative. So it is important that we must be creative at this particular time when life is very difficult. I've suggested the 5 ways to well-being. These are evidenced and practical actions that have been shown to help achieve resilience. Number 1 is to learn Number 2, connect. 3, give. 4, take notice. And then the last one is to be active. So we'll have a look at this one by one. It is important for us to learn new knowledge. And this, as we know it, as we all know it, that if you acquire new knowledge, this can give you a sense of achievement and a sense of reward, even during difficult times like this. Reading magazines, newspapers, which contain new information that may stimulate learning and other opportunities to develop your skills, are very important in giving you a sense of reward and mental health well-being. For those that can access internet and knowledge of how to use it, of course, free teaching on a range of subject matters are easily accessible. For example, learning how to cook, simple things like those, even playing a musical instrument, or even building a house, all those things are useful as resilient strategies. And number 2, it's important for us to stay connected. And I dare say that, meaning interaction with others can promote self-worth and a sense of identity. Without the ability to meet face-to-face and with increased free time, new technologies may be embraced, allowing them to be used regularly to build familiarity with the technology and to allow you a more meaningful communication with others. We do know that physical isolation of whole communities and their homes may allow also for opportunity for the community to connect with one another, which previously lacked. People spent most of the time working, and now they have an opportunity to closely interact and relate with the community or the members of their family. Then to give. To give is an African nature, and the act of giving has led to strengthening of bonds with the communities. And we know that when you strengthen bonds and interpersonal relationships, all this improves your mental health status. This current opportunity to pull together in the face of adversity and contribute toward a greater global goal can give similar sense of purpose, which can be experienced, of course, by everyone, including the healthcare workers. Then take notice. What are you taking notice of? This is, we call it mindfulness. It is important that you mind or you take notice of the present moment, and this improves the mental well-being. Sometimes it's just important to just look through your environment. Just appreciate what you are seeing in front of you. It could be just looking at the colors in a sunset, for example, enjoying maybe a sound of the rain on top of your roof, enjoying the birds, hovering all around your compound, or just feeling, your nice drink, just feel the taste. Yesterday, I attended a webinar by Dr. Koba, and he mentioned that the husband keeps reminding her that enjoy your tea, chew it nicely, as if you are chewing something. Can you imagine chewing tea? Take it with the passion. You are taking notice of the little things that are around you. It's very important. Appreciate one another, appreciate your partner, enjoy what you see in front of you. Take notice. Being mindfulness as a very important resilient strategy. The last one is being active. Physical activity has been described as a miracle cure, with very impressive evidence of benefits to body and mind. I know that during these periods of COVID lockdown, there are unusual opportunities for physical activities much reduced, or rather the usual opportunities are much reduced. Although many have taken up, running in the mornings, cycling, bikes, all those are very important. Exercising at home is also possible. You have seen the mushrooming of new TV programs, especially in the morning hours, with the trainers showing you simple exercises for you just to kickstart your day. All those are resilient strategies. Don't take them for granted. Just wake up at 6, after having a nice sleep, 6 to 8 hours, and join the trainers on the TV and follow what they are doing. Sometimes you might think, oh, you can't do much, your body feel weak. Studies have shown that even just standing and sitting again may be useful as far as being active is concerned. Other than the 5 well-being strategies, I do recommend the following as resilience strategies during this current novel coronavirus pandemic. If you feel overwhelmed as a health worker, it is important to take a break. Take a break. If you find yourself feeling overwhelmed, take time with the technology break, go for a walk, spend some time journaling, or playing a board game on your own or your important others. Number 2, avoid substances. Avoid substances. It is not unusual that during stressful times, people sometimes turn to alcohol to relieve stress or cope with symptoms of mental health challenges. The misuse of alcohol in this way can lead to substance use disorders, as we all know it, and other health-related issues, relationship issues, and even employment challenges that we dearly need. It is important that today, after this talk, that we take time by avoiding alcohol. For those who take alcohol, assess your relationship with it, or reach out if you need assistance. Number 3, healthy diet. Nutritionists tell us that it is important to eat a well-balanced diet as a starting point. And this, we can see it's also highlighted in the Maslow hierarchy of needs. Food is very basic. It's very important for us to eat healthy diet, for us to maintain a healthy mental health state. I therefore urge all of us to take time today by making a healthy meal. I know it is not yet late, or identify ways that you can better fuel your body through your favorite food. If not today, then tomorrow, as soonest possible. The next resilience strategy is having enough rest and sleep. Stress can cause a lack of sleep, or what we call insomnia, which can further become a stressor in itself. Sleep is often overlooked by many people. People think that if you spend time sleeping, then you're the lazy type. The answer is no, you need not less than 6 hours of sleep a day. So again, assess your sleeping pattern. If you are sleeping less than 6 hours a day, know there is something wrong. You are not doing a service to your mental health. We do know from the literature that sleep is important just for the body to reboot itself. You can imagine if you have overworked your computer, you just see it switching off. It tells you the system is rebooting. We also reboot ourselves during sleep. So you can imagine if you don't allow your brain to reboot, you don't allow your muscles to recover, you don't allow your hormones to reset, what you are doing to your own mental health. It is important to have rest and sleep. I know it is difficult as healthcare workers, but it's important for us to create that time for ourselves. If you are not here today, someone else will be there tomorrow to do exactly what you are doing. So it is important to take care of your own mental health, to be able to provide similar services to others. Again, it is important to just stroll around, what we call the milieu therapy. Just stroll around. As I've said, just stroll around, notice good things around you. Sometimes just getting outside for a walk around a neighborhood, going on for a short road trip to a national park. Even sitting outside with your pets, for those who love pets, can make a very huge difference. And then it's important for us to make a routine, a daily routine around what I've already said as resilient strategies. Having a regular routine is important for physical and mental well-being. And of course, this can ease the disturbance caused by the loss of the usual daily structures of activities or work or schooling that have, of course, been disrupted by the COVID pandemic. Then, of course, if you can't, then seek professional help. And professional help is available. We have counselors, we have psychiatric nurses, we have psychiatrists, and of course, clinical psychologists, all available to provide mental health assistance to our healthcare workers. I'm aware that we have toll centers to assist or other healthcare workers that may be undergoing through psychological distress. In conclusion, from its beginning, it was recognized that the coronavirus pandemic would likely create a burden on mental ill health in the general population. However, as we know it, pandemics are multifaceted phenomenon, exposing people not only to the risk of illness, but also to the social restrictions and potential economic hardships that are necessitated by efforts to control its spread. Health professionals have changed their way of life and working to decrease coronavirus infectivity, causing additional stress and increasing potential for mental illness. The continued so-called third wave spread of COVID-19 prompts psychological trouble, and so emphasizes on the need for resilient strategies as a useful uplifting in the resilient strategies useful in uplifting the mental health of our healthcare workers. The suggested resilient strategies, as we have seen in this presentation, include learning, staying connected, giving to the society, taking notice of present moments, being active, taking time off our regular duties, avoiding substance abuse, seeking prompt help, healthy eating behavior, enough rest, strolling around, and building a daily routine around those strategies. It is therefore important to continue having these conversations to find amicable ways of improving resilience, and also to keep reminding the healthcare workers during this COVID pandemic to keep them in good state of mental health, even as they remain the frontliners in the fight against COVID pandemic. These are some of the readings. For those who like reading, you can refer to some of the articles there. And as I conclude, please remember, when the going gets tough, the tough gets creative. That's the end of my presentation. Thank you very much for joining this webinar.
Thank you so much, Dr. Richard Ogutu Owino, for the wonderful presentation. I'll just request if you can be able to take off your screen, stop the screen sharing. So wonderful presentation indeed. You've been able to take us through the background, the impact of COVID, the mental health concerns. You've also taken us through the concerns, what are the concerns that we are in regards to feeling of isolation, uncertainty, anxiety, depression, and also issues of substance abuse. You've also taken us through the early signs that that we really need to be able to be of concern, that we should really be able to leave them unnoticed. And of course, you've also taken us through the resilience strategies, how we need to be able to maintain the well-being, and also wonderful inputs, which has also been given by part of our attendees, especially Imelda, really giving us a very good ways of, going towards other ventures of, having siblings and also doing the thing that it really supports that. So we'll be able to have question and answer sessions, colleagues, and I'll just request that if you really need to be able to ask a question now, just pause and we'll be able to pick up that. It's now my pleasure to introduce the second speaker. Our second speaker is Mr. Francis. Mr. Francis is here with us, having worked within the Nakuru County and also leading the COVID-19 isolation centers and being in charge of also the home-based care management. Francis Githae Njega, it is my singular pleasure to welcome you this evening. Karibu sana. You can unmute your mic and talk to us and tell us your experiences in regards of these mental health issues within the healthcare workers in your line of duty. Welcome, Mr. Francis. Let us know if you have any technical glitch, but unmute your mic.
Okay, thank you very much. I wish to do this presentation while on the go, but I wish to request if somebody can load the presentation for me from that end. Is it possible?
Oh yeah, Teddy. Teddy is doing that right away. Thank you so much, Teddy. Wonderful.
Okay. All right, you are hearing me?
Yes, Francis. Here we are able to hear you. Go ahead.
Okay. I'm going to share my experience. As you have seen from my write up there, I was the first manager at the COVID center in Nakuru County, Nakuru PGH, and I've had some experience. I worked there for about 6 months, and then I was transferred to work in the home-based isolation and care. But for the sake of the presentation first, I'd like us to go to the next slide so that we can move on. So what is presented here is just the situation report by yesterday. This is what we had in Nakuru County. I'm doing this so that you are able to have a picture of what Nakuru was and how Nakuru is. So far, we have had a total of about 74, 72 COVID patients. And as you can see, the number of males is almost twice as that of females. And we have had about 212 deaths, the ones which have been reported. And by yesterday, the case fatality rate was at 2.8%. And although most of our patients are now on home-based isolation and care, and by yesterday, we have had a total of 6,198. And so far by yesterday, the ones which we have are 334. This is a very big rise from what we had about a month ago. A month ago, we had about 80, but now you can see the number which has gone. Next slide. So this slide is basically how we started the COVID center. You can see from my presentation there, the number of nurses was the number of nurses were 12 and we had about 26. This is about 12, twice the number of total staff who are there. This staff includes also the support staff, and you can see the largest number of staff there were actually nurses, 12 of them against 28 beds which are there. Next slide. First of all, this isolation center was set abruptly because when they looked at the hospital, we didn't have what was there before was a small unit. So the administration thought of what to do. So they went for the I unit. For those of you who have been at Nakuru level 5, you know where the I unit is because they thought it was more isolated. It was just at one corner of the hospital and they thought this was ideal. Unfortunately, this unit was not built as an isolation center, as you can see from my presentation, and there were quite a lot of challenges when it came to infection prevention and control. Secondly, the deployment of staff was actually done so fast. They didn't even consider about so many things like skills, like the people who have been there before, or those people who have dealt with IPC, but they just picked staff and posted them there. And because of that, so many people thought a lot of people had a lot of pressure and a lot of stress. Something else also you can see from my presentation, there was quite a lot of shortage for nurses. We had only 12 nurses serving about 5 shifts, the ones which are listed there, including morning. Some could come in the afternoon. There were nurses on night duty. There were also nurses on night off, and also nurses maybe who are on sick off, nurses who are off duty. And you could, that one was actually placing a lot of stress on the center. And during the day, you could find maybe only 2 nurses, and there are so many activities to be done. Because in one, there was a time when during the first wave, there was a time the whole ward was full, even during the peak of the second wave, and even now the ward is almost full. Next slide. So some of the mental health concerns which were actually raised by staff and which were experienced was actually the risk of exposure, the risk of exposure due to inadequate knowledge and skills on downing and doving. Actually, what happened here, when the staff were posted there, they had not gone through a thorough process of downing and doving, and the staff who were posted there were just learning on the job how to load and how to dove. And from the experiences or from the narration, they had been told, if you don't dove well, there's a very high chance that you could be infected or you could transmit the infection to your family. Then the other thing, when we started, there was quite a lot of shortage for PPEs. Something else we thought during the starting of the COVID center, we thought every procedure, the nurse should be in complete PPE. This one was actually a challenge because it made what was available to get finished very fast. And then something else also, the deployment. I'm sorry, I'm on the road, but then I'm trying to present deployment of the deployment of nursing duties, AG laboratory records and management officers was also done there. They were deployed, but they also placed under the nurse to manage them during to manage them at the center. The other point was that balancing quality of care with the duty to care was actually a challenge. And also there was some political interference at the center, because what used to happen is that due to some politicians could call and maybe demand to have a bed reserved for them, or to demand an oxygen cylinder be reserved for them. And you see, this one to the nurses was actually something difficult, because you could not deny one patient and then reserve something for the other patient. So this was placing a lot of stress on the nurses. Then something else, due to the COVID infections, our patients who had nobody even to take care of their mental situations, they were actually very angry. You could find them, they were very actually, sometimes they even, one of them attacked a nurse, and it was very difficult sometimes for the nurses to actually manage the situation, especially at night when you have 28 patients. Some of them were not in very critical condition, but they were there. You remember initially, every patient, irrespective of whether you are positive or suspected, you are admitted at the center. So there were some patients who were actually asymptomatic. They were at the center. They were very irritable, and most of the times they were not, because of their separation from the families, and the placement was sometimes done forcibly. These people are very irritable, and there were times they were even trying to do violence on the nurses, and this one placed a lot of strain on the nurses. Next slide, please. So still on mental health concerns, it's the same thing like fear of infection and transmission of infections or death. So here, the nurses were always asking themselves, what if I become infected? Would I survive? So many other patients had come to the facility, and we found some of them had passed on, and this fear actually came on to the nurses. Then the other thing is actually stigmatization. The staff who were deployed there, they were not any special staff, they were just nurses deployed there, and suddenly other members of staff used to refer to them as these people of corona, corona. And you could find that one was actually derogatory, and the nurses could feel as if they were stigmatized. Then the other one was discrimination. We found during the deployment, the nurses who were deployed there, they did not understand why they were picked and not the others. So this had placed in them a sense of that I have been discriminated because of this or that. And this one actually placed a lot of stress on the nurses and even on their patients. Next slide, please. And then the other thing which was coming to the nurses during the initial stages of the pandemic was that there was this feeling of self-guilt, because there are some nurses who are thinking, maybe I did something wrong, and that's why I was picked too. Because initially people thought when you are deployed in in the COVID center, it was like a punishment. So they thought maybe I had done something wrong, and this one has made me to be punished, to be deployed in the isolation center. Also, there was also a sense of betrayal, because I remember 2 nurses, they kept asking, who actually gave my name to the county department of health? Because I know as a nurse working in a health center, the county does not know me, and somebody must have given them my name so that I was deployed here. So that is one of them. One of the things that the nurses felt maybe somebody had betrayed them, and maybe they were that led to their being deployed to the center. Also, there was this psychological trauma, because initially, due to the negativity on the COVID-19, and when the death started happening at the center, there was quite a lot of trauma. I remember there was a time one of the nurses, when the patient died at night, the mortuary attendants came and demanded that the nurse to escort the body up to the mortuary so that they could go there and maybe do the necessary at the mortuary. So when this nurse left, she was actually very traumatized, because she was pulled from the ward and taken to mortuary to do all, and in the mortuary there were other dead bodies. So that one was actually another thing. Then also, during the initial stages, there was quite a lot of psychological distress and burnout due to the fatigue. You remember there were 28 beds, and there was a time all the beds were full. So there was, and you find there were about 2 or 3 nurses reporting per shift. And there were so many activities to be done by the nurses inside the ward, because we had a few beds for the critically ill. So when you don't, it could take a nurse maybe up to 4 or 5 hours still on the PPE. And this one created a lot of fatigue, and actually created a lot of psychological stress on the nurses. Next slide, please. You find, due to all the factors that I've mentioned, some of the nurses actually became very irritable. When you ask them something, you could find them answering. They are answering you very rudely, because they were actually very irritable. And it was all because of what they were going in during the initial stages. There was also a sense of anger. There was a lot of anger. Some nurses who had tested positive for COVID-19, they started blaming themselves. They didn't know why had they tested positive. Is it because they worked in this department and they were infected? Is it because of all the other factors? And initially people are not volunteering to go and work at the COVID center. So these nurses were actually very angry, and this one is also affecting them. Then there was also a feeling of desperation, because so many, I remember I was the nurse manager there, and so many of the nurses had come to me trying to ask me whether they can be discharged from the unit. But you see, the bosses had said these nurses are going to work here for maybe 4 to 5 months before they are replaced. So, and because the nurses were coming up with so many excuses, some could even take sick offs, some could even create a lot of excuses just to be out of the place. So these nurses felt they were they had a sense of desperation. Maybe they really wanted to leave the place, and it was placing a lot of psychological stress on them. Next slide. So some of the strategies, that is resilience. What is there is actually resilience. Just a moment. Let me go. What it is not resilience, it's actually resilience. So what the administration actually came up with a few things to help the nurses cope, to motivate the nurses, and one of them was actually the support supervision. Every morning, you found a senior nurse from the administration would come to the unit to discuss with the nurses in the unit, to solve with them, together with them, without actually commanding them to do just
Dr. Francis, we seem to have lost you. Okay, we just want to appreciate the support that Francis has been able to work on us. We just want to request Teddy if you can be able to pull off your slides. Thank you so much. I hope you can hear me from my side. That was Francis. Colleagues, as you heard, that he was also trying to be able to work in this webinar as he was in Safari, but quickly to really be able to put it up is that it's really bringing a lot of mental health concerns, that it is really affecting the nurse, and really speaking from the frontline healthcare worker, where he's able to be able to experience all these issues within the framework that is working, issues of risk of exposure, issues of deployment, fears of infection, issues of inability, hunger, and we can really be able to relate all these that is able to be able to bring on to also our earlier presentation by Dr. Ogutu on the mental health concern and the strategies that we need to be able to employ. We just want to also go back and also go to the Q&A questions, and a lot of questions has really been raised, which really needs for us to be able to make a reflection and do that. I want to ask Dr. Richard Ogutu. Most of the questions has been brought forth to you, and I just want to ask that you quickly be able to respond on the issues which have been raised by the colleagues, both at the Q&A and those who have been able to be forwarded to us. And most of the concerns that they have been raised is that the contents to be covered within the counseling, which has been asked by Rotich. Also, how do we have the gap, the worries experienced by the healthcare workers, which affect the mental and psychological at workplace, issues of scarcity of PPEs in comparison to attending emergency, mental effects of complications of COVID infection, and also medical cover of contract nurses, which is not comprehensive. I'll be able to pick up the issues of scarcity of PPEs, but you can be able to also answer the other questions which has been raised by the attendees. Dr. Ogutu.
Thank you very much, Madam Registrar, and the audience for the questions. The one that I've picked as the content to be involved when you're doing counseling. Of course, this one takes us through the rigorous process of counseling process, of helping an individual defining the problem. They need to know their efforts, how strong are they in managing that particular problem. If they are able, they need to be assisted to access their inner energy so that they're able to solve that particular problem. If they're not able, then of course they seek a professional intervention that is not just counseling, but including other interventional strategies, which can include very complex psychological interventions, which include behavior therapies, individual psychotherapies, CBTs, and things like those. And of course, God forbid, if the worst comes to the worst, then the use of medications as well. Okay.
Thank you so much, Ogutu. Just before you leave us there, again, there's also a very important question which has been raised on family members of healthcare workers that are also undergoing mental health issues because of their nature of the work and risk level. What strategies can healthcare workers apply to be able to mitigate this?
I do thank you for that question. I do know that the worst healthcare seekers are the healthcare workers. The worst stigmatizing individuals are healthcare workers. I'm also aware that most healthcare workers tend to hide their mentally sick individuals at home. They don't want them to be known, and all that does not work well for them. So as I said, we have toll centers for the health care providers, and take note that this also include their significant others, that their healthcare, their mental health state affects what they do at work. So it is important that healthcare workers recognize that they need help and they have help available. There is nothing wrong if someone does not feel mentally okay. The brain is part of our body and it can get sick just like the hair can get sick. So there is nothing wrong not to be okay with the brain.
Thank you. Thank you so much, Dr. Richard. We'll request Jacinta Moki to quickly speak on the issues of scarcity of PPEs, as I also request Francis, welcome back, Francis, and also speak through what is the multidisciplinary COVID, was there a multidisciplinary COVID committee within your county in regards of taking care of this COVID? So Jacinta, go, and then I will request Francis. If you're back with us, you can be able to answer that question.
Hi, everyone. Thank you very much. Thank you very much, Madam Registrar. Just a brief on the scarcity of PPE. I would say that it hasn't been such a real issue in terms of provision of PPE by the county government. However, we've had shortages on and off. We've had shortages of even up to going short of gloves. But I would say that at least the county governments have tried. Specifically, I'm speaking on behalf of Machakos County. They've tried to ensure that the PPEs are available. However, I would say that it's not that it's available 100%. Would range it at around 85, 90% in terms of full availability of PPEs.
Thank you.
But again, I would like to request, rather to tell the nurses that when it comes to a pandemic, we do not have an emergency when it comes to a pandemic, and it is your life that you need to save. Because if we lose the health worker, again, there is no one to take care of the patient. So we really need to take care of ourselves and ensure that whatever environment that you are working in, we have enough and quality PPE that is safe to work with. But I would like to appreciate the government. I'm sure they're doing their level best to ensure that PPE is available in each and every facility.
Thank you so much, Jacinta. And Francis, welcome back to us. I think that was an awesome way of just summarizing the issues of the PPEs, and we really appreciate the work that associations have continued to do. Francis, just to recap, to quickly also add on the issue of, was there a multidisciplinary committee within you? Of course, other things which are also coming up from attendees is also the questions of that, was there a criteria that you used within your county to select nurses to the isolation center? And also what is also coming up is that COVID-19 patients are so many, and there's a lot of stress within the nursing fraternity. And what are the best strategies for us to be able to do? Or also because the concern is that we are just dying with the patients. I think Dr. Ogutu, you had made a presentation of what should be the best strategies, and I'll just want to request kindly just a response to those two issues raised, Francis.
Is it possible to run the slide again?
Not really, Francis. You can quickly summarize the questions which have been posed by the attendees online.
Okay, very briefly.
Share the slides, and we will be able to have that information shared with all the attendees.
Okay, very briefly, the administration actually came up with coping mechanisms, most of which are actually summarized in the slide, including the nurses themselves. They also came up with their own modalities of trying to cope. And over time, the nurses were actually starting to love working in the unit. And by now, the nurses who are there in the unit, although I have since left, I'm now coordinating the home-based isolation and care. But I usually do a lot of this there. The nurses who are there at the moment, because we have at least two clinical psychologists who are taking care of the patient and the staff themselves. Today, if you go to that unit, you find the work is actually better because the nurses are more the nurses are more willing to work there. They are coping with the situation and they are loving it, and they are actually now the situation is a bit better. Thank you.
Thank you so much. I also want to take this singular pleasure to recognize the team from the Africa University Zimbabwe, headed by Professor Peter Mageto and the team here. And Professor Mageto also has given questions directed to Dr. Ogutu in regards of the strategies that we recommend institution, organization, or hospitals where the healthcare workers face challenges that trigger most of the mental health issues to that. Could you quickly speak to that? Dr. Ogutu.
Thank you very much. I think that question is from Peter Mageto. These are issues that are cross-cutting. You may not have a straight jacket kind of answer because the response needs to be multi-sectoral, but all the same, there are those simple issues that team leaders in our institutions can do so as to promote the mental health status of our staff. One, they need to open avenues for free discussion. They need to be democratic in nature. The autocratic nature of nursing and rather health disciplines is all gone. So we need to open an avenue by the health leaders that allows our disturbed healthcare providers to freely access them and freely share their concerns. Number two, I know there are some institutions that have established clear centers that takes care of the mental or psychosocial support of their mental health staff. An example is MTRH where I work. I do know that we have a center that addresses this. We even consider health workers' mental health issues separately from the general population. Those two will be very important. Number three, of course, there are issues with payment, economic support. All those are really issues that I cannot address myself to, but I do know that the government is making every effort to ensure that health workers are motivated in terms of their salaries, in terms of provision of the PPEs and things that they need for them to work effectively without necessarily suffering psychological distress, as we are seeing from the Nakuru case, which is really unfortunate. Again, another important thing that has come out from Francis' presentation, consultation is very key. We need to explain to our workers that you swore to be a healthcare provider and you can work anywhere, so that it doesn't look like if you are assigned a duty, then it looks like a punishment. Thank you very much.
Thank you so much. And there is also a question for the council, and I wear two hats tonight as a moderator, and also I still wear the hat of the registrar for the council. I just want to acknowledge the question which has been raised by our colleague here in regards of the council measures to taking for the shortages experienced in Nakuru. I'll say that this is a global challenge and it's also a national challenge, and we strive together with the multidisciplinary team with the national task forces on facility preparedness to work towards ensuring that there's adequate personnel in each and every center. And we've done recommendation, we'll be able to do the follow-up. In also regards to the question of the NCK really acknowledging causes like psychology and mental health, I'll want to say that we have been able to really be able to have mental health at our hearts and also have this specialization also being able to progress. But the issues of psychology and that can really be able to be handled very, very well when we'll be working towards our scheme of practice currently called career progression guidelines, where we are be able to bring up the specializations and their job description, which will be able to fit the era where we are. So there's a lot of integration, whether you've done the psychology and mental health within our hospitals, and the conversation that we are going to be able to have both at the national government and also the county government, and of course with the guidance of the public service commissions. We'll be happy to engage you when that time comes up. So I just want to just give a minute to Julie Matiba. Julie Matiba, you may ask your question or a comment just before we have a close-up session. Julie, your hand is up. Okay.
Sorry, I think that was by mistake, sorry.
All right. Okay. Thank you so much, Julie. And thank you, everyone who has been able to attend our evening webinar for us to be able to speak more on the issues of health concerns. We still have a lot of questions, perhaps we may not have answered, but the colleagues and my team who are part of the panelists has been able to answer them. We'll be able to continue with this conversation. I want to welcome Mr. Rashid to quickly take us through our end of the poll. Rashid.
Thank you so much, Madam Moderator. Just like we started, we had a poll just to get our baseline information. And so as we finish up as well, we'd like to understand another poll that is coming up. And this time we are asking you whether you, well, how you'll rate your mental health over the past few months. The poll is just coming up. So take a moment to answer. Once you've answered, kindly submit, then we shall be able to share the results in a minute or so. Maybe something else that I was to mention is that when you look at the chat section, we've also put up how to claim your CPD points, the procedure. I know this is something that most of us have really complained. We've received emails about it as well. We're really trying the best we can in partnership with, in consultation with the Nursing Council to see how best we can help you out. But the procedure is you go into the NCK account via the osp.nckenya.com, then log on to the courses, click on the live events, enter the secret code that you've been provided within this webinar, then validate and submit, and you're done. And this procedure is under the chat section. I'll be able to also share through the email as well. Thank you so much as we take a moment to fill the poll. Back to you, Madam Registrar.
Thank you so much, Rashid. And as we wait for a minute for us to be able to check on our poll, Francis Githainjeka, thank you so much. You have also notified us that if we want to have a feeling of what is like working as a nurse in Nakuru Level 5 Isolation Treatment Center, we need to go to the blog of Nakuru Health Digest and we follow and we scroll it. Wonderful, wonderful inputs that you are bringing on, and innovation and also utilization of the social media platforms. I also wish also to acknowledge all our colleagues who have attended. We are 213 participants tonight. I want to say thank you so much from wherever you are joining. We are so appreciation that you are been able to get time for you to be able to share with us the knowledge and also the discussion and see how we can be able to work as a profession together with our other colleagues in issues of the mental health within ourselves. Thank you so much, eminent person who have joined here tonight, our colleagues in academia, in the training institutions, in the health facilities, also working within the NGOs and also other partners. Asante sana, and may God bless you. Rashid, we want also to be able to share our poll tonight, and we are still where we were overall. How will you be able to rate our mental health over the past 1 month? 10% is said excellent, somewhat good is 33%, average is 44, somewhat poor is 8, and poor is 5. I want to say that we need to really take care of the 5%, the 8%, and even the 44%. We want all of us to be somewhat good and above excellent. Please let us adhere to the measures. Let us have the psychological support center, which is being hosted by our associations. And at the same time, again, 48% of us say that they've not felt to see a need of a therapist, but 39% said yes. I really hope that you have been able to really get that mental health therapist over here with us. And I know Ogutu and colleagues, you are able to also offer pro bono services to our healthcare providers for us to do this. 39% of us tonight, I just want to urge that let us seek mental health therapists in the recent past and in the future, so that we are able to have our health. As I always said in the beginning, no health without mental health. Asante sana and a good evening.
Thank you very much.
Thank you.
Bye.
Dr. Samir, bye-bye.
Bye.
Bye.
Bye-bye.
Bye-bye. Good evening. Thank you.